everybody. Dr. Jaime Seeman here. Welcome back. Today, we're going to be talking about a very important topic, which is the pandemic that is bigger than COVID-19. As you all know, I'm a board-certified obstetrician and gynecologist with a special interest in integrative and functional medicine. I'm also a board-certified ketogenic nutrition specialist. Today's video, we have a really amazing guest with us, Dr. Robert Penn. I'm going to let Dr. Penn introduce himself to all of you.
Thank you, Dr. Seeman. It's an honor to be here today. I'm a board-certified internist and infectious disease specialist, and have also obtained certification in functional nutrition. I serve as a medical director of infection prevention and control at Methodist Hospital here in Omaha, Nebraska.
So Dr. Penn has been working on the front lines of the COVID-19 crisis, but him and I both have this special interest in functional nutrition and integrative therapies, and that's what we're really going to talk about today. When we talk about the pandemic that's bigger than COVID-19, what we're really addressing is the severe cases of metabolic disease that we not only see in our own community, but across the United States and really internationally and globally. Recently, Dr. Aseem Malhotra made international headlines talking about how the British Prime Minister, Boris Johnson, became extremely critically ill with COVID-19 and made connections that he may have been more severely affected due to his weight and likely underlying metabolic disease. And I think this has kind of been the big elephant in the room that nobody really wants to talk about and address. So we're gonna start to talk about that here today. Metabolic disease is a big problem. It has a larger economic impact than COVID-19 ever will. We're talking about something in the realm of $43 trillion of international economic impact. And there is some interesting data that we've looked at, looking at how many people in our country might be carrying metabolic disease. And a lot of times you can't judge a book by the cover. You don't always know what's going on underneath, because there are people that are not obese and still have these diseases. Dr. Penn, what have you seen as far as the rates of metabolic disease in our country and in our community?
Well, Dr. Seeman, there's a June Stevens and her colleagues out of the University of North Carolina that last year, and I think you said you mentioned this in your last presentation, that they reviewed over approximately a 10-year period of time or so, what is the metabolic or cardiometabolic health of our American population. And what they found, that it was a dismal 12% of Americans have optimal metabolic health. And we know that when you do not have optimal metabolic health, you do not have an optimal immune system.
That's correct. So the connection that we're making here is that our susceptibility to things like viruses and in our world and in our environment is directly tied to our metabolic health and glycemic variability. And in this particular study that you and I are both referencing, with only 12% of people being metabolically healthy, they really used 5 parameters to determine what optimal metabolic health was. And just to review those 5 parameters, they were waist circumference, blood pressure, triglyceride levels, HDL cholesterol, and
blood sugars,
and your fasting glucose level. So those 5 parameters, and basically 88% of the people that they looked at from this data at least had one of those that was abnormal, meaning only 12% could meet all 5 of those, which is really astonishing.
And I think it's probably important to add, if you look at normal weight, only 1/3 of individuals with normal weight had optimal metabolic function.
Right, which is important because somebody like me, I was a normal weight, but then got diagnosed with prediabetes. So once again, you cannot judge the book by its cover unless you truly know what those 5 markers are for your health. So the reason that these metabolic markers are important is because these metabolic markers have an impact on something called our microbiome. So Dr. Penn, you're an infectious disease specialist. This is your wheelhouse. So tell us, what is the microbiome and why is it so important for human health?
Well, Dr. Seeman, this is an area of intense research. In fact, the study of the microbiome is the center of our bioscience endeavor at this point in time. And interestingly, if we go back years ago in my fellowship, I came into the program with the stipulation that I would do research with the microbiome. Little did we know that it was the microbiome at that point in time, but what we did, we studied the bacteria in the throat area that would prevent group A strep infection. We knew there was a streptococcus, a part of your, now what we call your microbiome, that would prevent strep infection. We called it bacterial interference back then. And then we got involved in all this antibiotic research, and we kind of lost interest, but beginning about a decade ago, that there was a resurgence of an interest in what we call the microbiome. And just for your audience, what is a microbiome? Well, we start with the term first, microbiota, and the microbiota refers to all the microorganisms within a given environment. And this can include bacteria, fungi, parasites, viruses. Primarily today, we're going to be talking about the bacteria being the microbiota. And then the microbiome is a term that has emerged that refers to all those microbiota in the environment and their genes.
So we're starting to hear a lot about the gut microbiome, but really what we want you to understand is that these bacteria and viral particles, they're everywhere. They're not only in our, physical environment, but they're in every area of our body. As a obstetrician and gynecologist, we used to believe that even the intrauterine environment was completely sterile. And now we know that even in the placenta, in the uterus, in the vagina, in every single body part and body area, there's a different ecosystem, a different microbiota that's at play. So how do we get the right bacteria in certain parts of our body? What determines the difference between something in the mouth versus something in the vagina?
Well, we know, Dr. Seeman, that this so-called hidden organ, as we've referred to it as, the microbiome, is established, as you've referred to, even while the baby is being carried within the mother's uterus. And that at the time of delivery, then, there's a significant impact on the microbiome for the rest of your life if you're born vaginally or via C-section. Ideally, a vaginal delivery gives you, it appears, a healthier start in life regarding your microbiome. Breastfeeding is also very important because breast milk also provides bacteria that are important for brain development. It also gives them what's called a prebiotic, or the food for the healthy bacteria to grow. So around 3 years of life, this microbiome is pretty well established in your gut. And there's 3 variables, ecologic variables, that determine your microbiome. It starts with immigration or migration, bacteria getting into given areas. And this gets a little complex, but you can just think about the bacteria at the time the baby is born is swallowing bacteria that it acquired from the vaginal area. So they migrate down into the intestinal tract, all over the skin. And we can come back and discuss, but we also now know bacteria are getting from the gut to other body organs, such as the lung, for example. And over time, this microbiome, about 3 years of age, becomes established. But over a lifetime, we now know there are perturbances that happen to throw off the balance of that healthy, functional core microbiome that leads to a state called dysbiosis.
Right. So the microbiome is established in utero, with delivery, with every piece of nutrition, stress, environment that this human encounters up until age 3, when it seems to stabilize. And then these other environmental influences still play a role. What we eat, everything we touch, we're talking about kids eating dirt, and all of these different things can create insult on our microbiome, leading to this dysbiosis. So what does dysbiosis really mean?
Well, if we accept the fact that you need a healthy, balanced microbiome throughout your body and the various so-called ecosystems to maintain optimal health, When you get an imbalance of that microbiome, and by that I mean you may lose specific keystone organisms that are very responsible for making healthy metabolites, which we can come back and discuss, or you may lose what we call diversity, which becomes important as we get seasoned in life. Or we may get a redistribution of bacteria. They're in spaces where they shouldn't be, like an overgrowth in the small bowel, for example, because as we go through the digestive tract, it's important to think in terms of function or anatomy, function, and physiology, but the gastrointestinal tract set up with a high pH in the stomach normally, so it controls bacterial overgrowth through the stomach and through much of the small bowel. And by the time you're getting to the distal small bowel and colon, the pH then is becoming more alkaline, which allows certain bacteria to grow. So you've got immigration factors, you've got elimination factors, and then you've got regional growth factors that are all determining what is in a given microbiome. And when the environmental factors you mentioned, including diet, stress, not getting exercise, not getting sleep, that can throw those balances all off because it can change the local conditions in that environment. And then you get an overgrowth, sometimes a blooming out of these so-called pathobionts or pathogenic bacteria that are not serving you well.
So a question I really have is, are the lungs really a sterile environment?
Not too long ago, it was said that the lungs were sterile. Like a fairy tale, we now know that the lungs have a microbiome, and this only goes back to about 5 years ago that it was well established. And much of this research has been done through Bob Dixon at the University of Michigan, and I kind of followed his research here recently, and he has established without a doubt that we have a normal lung microbiome. Now, interestingly, if you compare it to the gut, there's much lower numbers of bacteria, although it's still fairly diverse. And one would ask, well, where does the lung microbiome come from? What are the immigration factors that lead to the lung microbiome? As it turns out, he is pretty well established with his colleagues that the lung microbiome is derived from our oral pharyngeal microbiome.
So this concept of leaky gut, can we talk about how leaky gut really leads to these perturbations in the microbiome in all areas of our body?
Well, we know, Dr. Seeman, that we're divided from the outside world by a barrier, if you will, and that is the epithelial cells that line our intestinal tract. It's estimated there's about 20 feet of small bowel, 4 to 5 feet of colon, and that the tissue that divides our body from the microorganisms is one layer of cells, of epithelial cells, held together by these tight junctions. Alessio Fasano is a pediatric gastroenterologist at Children's at Mass General, who discovered now approximately 20 years ago that those tight junctions are opened by a hormone called zonulin. And zonulin is released by a number of factors, as it turns out. And this includes certain foods that you eat, such as sugars, refined grains appear to open up. There's certain toxins that we ingest, like maybe a glyphosate. Dysbiosis in itself will open up these tight junctions. And thus, these tight junctions normally are closed. The micronutrients that we get through digesting our food normally are taken up through the cells by transport mechanisms. But when these tight junctions open up, there's metabolites in poorly digested foods that get across, and 70% of our immune system then is on the other side of that barrier, so to speak. And when those foreign particles get through, our immune system can be activated. So this leaky gut concept, what is hypothesized now, that is leading to then low-grade ongoing chronic inflammation, which may be behind all these chronic metabolic conditions that we've already mentioned.
So as an infectious disease specialist, do you feel like kind of the gateway really to our immune system and to our microbiome probably lies in the gut?
Yes.
Yeah. And there's, of course, a lot of things that can affect the gut. So one of them is antibiotic use in lifetime. And we know that babies and children that are exposed to more antibiotic exposure early in life tend to have more perturbations in their gut and more dysbiosis. Is that right? Antibiotic influence?
Correct. Yeah.
Yeah. And then other things that we prescribe as physicians, so medications that alter the pH of the gastric contents, with the most widely prescribed medications, which are acid reflux medications, can contribute. And then, of course, we talked about these other things like stress, toxins, and the biggest one, my personal belief, is nutrition has one of the biggest impacts on this gut lining. Do you feel the same way about that?
Yeah, because we asked the question, why is there such an explosion of metabolic disease in our society? All these metabolic conditions, over 500,000 people dying of heart disease or diabetic-related complications. Is there a unifying theory? And it would be my opinion too, Dr. Seeman, that unifying theory is centered around diet, nutrition.
Yeah. So you've been taking care of, COVID patients, and you've seen these patients that are severely ill on ventilators. And a lot of the studies that were initially coming out were showing that the patients that were more severely affected also had higher proportions of metabolic disease. And when you become critically ill, when you are at a point where you have something like acute respiratory distress and you are needing a ventilator to sustain life, there are some changes that happen inside of our bodies. We decrease the transit time inside of our GI tract. The pH starts to change. We have less bile production that's happening, a decrease in IgA. But there was a study that I had seen, Dixon in 2020, a very recent study looking at the bacteria inside the lungs of the patients that were on ventilators, and there was a change in ventilator-associated outcomes in these patients. Can you touch on that, of these people that get severely ill?
Yeah, what Bob Dixon and his colleagues recently published, and the research you're referring to, is they were able to associate poorer outcome, decreased chance of survival when you have what's called acute respiratory distress syndrome, which COVID-19 is leading to, although it's become a little more complex than that.
Yeah.
But if you're critically ill on a ventilator, what they were able to show was an association with a change in that lung microbiome. And what they established was that what happened with compared to a normal lung microbiome, which appear to be friendly bacteria and probably releasing good metabolites, keeping a balance, that there was gut bacteria that translocated to the lung. And the hypothesis is that bacteria can get from the gut by several ways. And one would be just when you open up those tight junctions, bacteria translocate, get into your blood circulation, which then is taken up through the lung.
To be oxygenated, right?
And then the other way is that, and surgeons have observed this over time, if you go in and sample the lymph nodes in the mesentery, you find bacteria, and they hypothesize that the lymphatic system can also take bacteria to the lung. And we know there's about 2 liters of lymphatic fluid that's drained from the intestinal tract and then goes up through the thoracic duct into the circulation and then through the lungs. So direct translocation through the bloodstream, lymphatic system. The other hypothesis, as we know, and you've mentioned, and this happens when you're critically ill, you get motilities thrown off, we throw drugs to decrease acid, and bacteria then begin to get redistributed into the small bowel and even into the stomach. And then if you look at critically ill or more seriously ill patients, you find a high rate, over 70% of these bacteria normally found in the colon, colonizing now in the oropharyngeal area. So, and as we know, we are always microaspirating, especially when you're sedated and you have somebody on the ventilator, you bypass the laryngeal area. And so microaspiration may be another way of those bacteria getting to your lung. And the fourth hypothesis was that we normally may have some of these bacteria in the lung, but they're at such low levels we can't detect them. But under stress conditions, for example, when you're under stress, you get more in the way of steroids or catecholamines, and that promotes the growth of these so-called pathobionts, and then may be able to bloom out because you've got the right growth conditions.
So people with metabolic disease are at a higher risk of severe disease. And then once these patients are on the ventilator, we know that once patients are at that state, it's this vicious, downward spiral like you've described. It's just feeding it more and more and more. So people with metabolic disease, the difference is they have this dysbiosis and it has already created a baseline pro-inflammatory state within the lung. And then you put another major insult like SARS-CoV-2 into these patients. And that's why the people with the 88% of people are the most susceptible people to this type of viral insult. So when we say who is the vulnerable patient, it's the 88% of people that don't have normal metabolic markers. Is that right?
Yes.
Yeah. It's pretty scary to think about the number of people that are really susceptible to this. So let's talk about kind of real world actionable steps that the 88% of the world can do to prevent this dysbiosis that leads to of these states. So let's talk in the mouth. You were talking about how the oral microbiome is really what determines what our lung microbiome looks like. So talk about oral hygiene a little bit and what people can do to influence the oral microbiome.
Well, since the lung microbiome appears to originate from the oral microbiome, it only becomes natural to think you need to optimize that oral microbiome. And it starts with good oral hygiene. Probably regular toothbrushing, as our dental hygienists would say, flossing perhaps once a day, regular dental visits for dental hygiene. Some people are prone to developing more plaque, which is sort of a biofilm of infection on the teeth, which can then lead to gum disease and a dysbiotic oral microbiome. And thus, if you get a dysregulated oral microbiome with bacteria that aren't so friendly and they end up in your lung, that we hypothesize will trigger then a dysbiotic lung microbiome. So good oral hygiene. And I would caution you as we approach the microbiome, always think in terms of factors that give you dysbiosis. And I think one of the most important things is, diet is important, but think in terms of toxins. Anything you're putting in your mouth that is toxic to your friendly bacteria will lead to dysbiosis. So it starts out making sure you're using a toothpaste that's bacterial friendly. And personally, I use several apps. One is Healthy Living from the Environmental Working Group. I always check my personal care products, including toothpaste. And then there's another one, Think Dirty, that you can check. And people are really surprised. I say, check your toothpaste. And there's carrageenan, which is toxic to our systems, and so on. So start out and look at what you're putting in your mouth, especially toothpaste.
Yeah, I think this concept of oral hygiene is interesting because hundreds of years ago, we didn't have toothbrushes and floss, and we didn't go to the dentist for every 6-month dental cleanings. And when you look at, somebody like Weston Price that went into these indigenous populations and cultures, they don't do all this crazy stuff. And it makes you wonder about the connection between what we are actually putting in our mouth. And the one thing that we put in our mouth most frequently is food or nutrition. And as we've seen a change in the diets of modern American culture, an increase in sugar, refined grains, and inflammatory vegetable oils, I hypothesize that is directly insulting the oral microbiome and has probably created a need for such aggressive oral hygiene.
Yes, in fact, Rob Lustig has stated that sugar, cocaine, and alcohol share two traits. One, they're all toxic and they're all addictive.
Yeah, it really is a true addiction. So then let's move down a little bit in the GI tract to the to the sinuses and then kind of in our esophagus and our stomach. We talked a little bit about things like acid reflux and medications, and talk a little bit about your sinuses and chronic sinusitis and ways that people could possibly improve these microbiomes in their body.
From an infectious disease standpoint, we see a fair number of patients referred for what's called chronic rhinosinusitis, and they're prone to getting recurrent acute rhinosinusitis. That evaluation does include looking at their immune systems to be sure they don't have a condition called common variable immune deficiency. We also know that chronic sinus disease, there's a gut-sinus axis or connection as well. So we need to address the gut in the background behind all this as well. But we look at the sinus area, and not uncommonly we have them start doing maximal medical management, which is irrigations. We do know hypertonic saline, for example, will kind of help rebalance the microbiome. We also now have probiotics that we will have them irrigate their nasal sinus areas with to help kind of restore a balanced nasal sinus microbiome.
And from an obstetrician perspective, you had touched on it earlier, babies born vaginally have a better microbiome and they have a decreased rate of things like allergy and asthma. And then we know that children or babies exposed to animals like dogs, actually having a pet in your home can play a huge role in your microbiome as well. Have you seen that data as well?
Yes, and you're referring to what's called the hygiene hypothesis, that if we over-sterilize our environment, those children don't get an optimal chance of developing their immune system.
So then let's move down into the gut, where we talked about this intestinal barrier being the number one most important thing really to our overall immune system, is having this good protection in the gut, this very fine, thin mucosal barrier, right? Being kind of the gateway to the rest of our body. So let's talk about our diets, because our diets over the last 100 years have really changed. When we look back to the early 1900s, the majority of fats in the diet really came mostly from animal fats. And then as we got into the nutritional recommendations of the 1960s and then into the 1980s, we saw fat kind of be vilified in the standard diet and an increase in refined grains and vegetable oils. So can we talk a little bit about these polyunsaturated fatty acids and why this imbalance of fat that was created in the diet creates such a dysbiosis and pro-inflammatory state in the gut?
Well, we now understand that these so-called polyunsaturated industrialized seed oils, like canola, corn, and so on, are very pro-inflammatory. They're readily oxidized. And it's really, if you get down to the cellular level, when we're talking about stress, inflammation, and you take it down to the cell level, it's really what's called oxidative stress. It's kind of the byproducts of your little batteries called mitochondria, or using oxygen to make energy. The problem, though, when you have this inflammatory state going on, you're in more of a danger mode. And then that translates into an oxidative stress and dysregulation then of the cell function, and perhaps very importantly is of the immune function, predisposing you to, and making you at high risk for infectious disease then.
Yeah, so things like industrial seed oils, because we see so much fried food. And I saw a presentation that you gave recently looking at things like French fries, a very commonly consumed food item in the United States, and a substance called acrolein. And tell everybody what eating one package of French fries was the equivalent of like smoking a certain number of cigarettes. Is that right?
Yes. Dr. Nobi, he is an ophthalmologist that presented that information, and I would refer you to his website in terms of age-related macular degeneration. And he was coming at this from the perspective that if you go back to the year 1900, we did not see macular degeneration, according to his research. But in this day and age, 1 in 3 Americans, by the time they're age 75, have macular degeneration now. And he has taken a real deep dive in understanding these industrialized seed oils and how toxic and pro-inflammatory they are. And just one of the toxins that he has been able to study is the acrolein you mentioned. And he likens one serving of French fries that is prepared in these industrialized seed oils that are oxidized and so on is like smoking 80 low acrolein cigarettes, 80 cigarettes. And so he shows a picture of a child with this serving of French fries, 80 cigarettes, French fries, which would you choose?
Yeah,
And they're
it's terrifying.
equally toxic, it appears.
Yeah. And when you walk through the grocery store, the majority of our grocery stores these days have these aisles that you can go up and down, and everything that comes in a bag or a box or in a jar, if you look at the ingredients listed on these labels, you see these industrialized seed oils. This is everything from breads to pastas to cereals to bars, Pop-Tarts, and of course, anything that's fried in these oils as well. But even the quote-unquote health foods, are not immune to this. I've noticed recently protein shakes even contain sunflower oils and canola oils. So you really have to be a savvy consumer when you're looking at the labels to see what is in these products. We have replaced a lot of the fat in our modern diet with these pro-inflammatory seed oils and vegetable oils.
And perhaps importantly is to understand they incorporate into the cell membrane and weaken it and lead to inflammation. And the half-life of that phenomenon is months to years. So not only is that child eating those French fries, but it's setting him up for cellular dysfunction for several years potentially. And that can be a cumulative, we know, that perturbance, so to speak, in life.
Right, so these are getting incorporated into the cellular membranes, and they really, once you've started to avoid them in your diet, could still be being released inside your body for, I believe it's like anywhere from 2 to 6 years when we look at the half-life of some of these things. And then the other thing that happened when we took a lot of these fats out of the diet was an increase in refined grains and sugars. So we're seeing an increasing amount of refined carb consumption and sugar consumption. Can you tell us what that does to our gut and how that contributes to dysbiosis?
We refer to the fact that sugar is toxic. So it starts out the standard American diet, high amounts of sugar intake. And unfortunately, the refined processed foods have eliminated the bacteria food, which is many times soluble or insoluble fiber, and replaced it with these refined sugars. And those sugars are readily absorbed in our proximal small bowel, and we begin to starve our bacteria then in the more distal bowel that are maintaining a very important role of maintaining optimal immune function, hormonal balance. Are we anxious or depressed or not because of those metabolites are releasing it? So when you begin to starve those bacteria, they start to eat away at your mucous membrane. You get inflammation that way. It's displaced by a dysbiotic type of microbiome. And so that's one level of toxicity. The other level is, and you can speak to this better than I can with your functional medicine background, but the sugar, when you get a sugar imbalance, and that's one of the metrics for metabolic syndrome, that when you get elevated sugar, we start with your defenses, the microbiome, skin and mucous membranes, but the third layer of defense is your immune system, especially the neutrophils. And the neutrophils normally concentrate vitamin C about 50 times greater than the surrounding tissue fluid. But when you have elevated blood sugars, they take up the sugar instead of the vitamin C, and they become dysfunctional. And I always tell my diabetics, if you balance your blood sugars, even though you got diabetes, if you can balance your blood sugars, keep your hemoglobin A1C down, you can have a normal immune system. But if you have this glycosylated hemoglobin, which is where the sugar binds to the protein, and that affects the immune system, then you're going to have immune dysfunction,
right?
A weakened immune system. So that sugar not only can affect the bacteria and what's going on in the gut, but then in terms of getting to the system, and then you get insulin resistance. And insulin resistance is really maybe behind all these medical conditions. Insulin is an extremely important hormone. If you have insulin resistance, you can't lose weight. It's associated with all those other metabolic dysfunction diseases we've discussed.
Right. I think that this idea of glycemic variability is extremely important. And you had mentioned that this soluble and insoluble fibers and what they are doing is feeding our gut bacteria, and they are making something called short chain fatty acids. So talk about why that's important for our overall health, because we know that, for instance, people that produce a lot of those short chain fatty acids have better heart health, better brain health. What benefits are those supplying?
Well, we know if we talk about this gut microbiome, Dr. Seeman, it's kind of an uncontrolled drug factory. All these metabolites that we're just now discovering, if you look at the bloodstream and measure the chemicals in your bloodstream, it's been estimated about 25% of the metabolites are coming from your gut bacteria. And some of the important and beneficial ones are these so-called short-chain fatty acids like butyrate. And there's a specific guild, if you will, of bacteria that produce those friendly substances. And they're like text messages. They're sending text messages from the gut to the lung, for example, and communicating that way. The immune systems communicate that way. And all is safe, all is calm, versus if that is thrown off and you're getting other metabolites that can be what are called pro-inflammatory, then the danger signal is sent out, and then that disrupts the local ecosystem, such as in the lung.
Yeah. So what's been interesting for me is Dr. Penn and I think very similarly on this subject, but when he's talking about text messages, I'm a board certified ketogenic nutrition specialist, and one of the interesting things to look at in the literature is that the ketogenic metabolism is a little bit different. And when you are in a ketogenic state, there was this study that had come out just about 2 years ago now showing that people with elevated levels of ketones seem to have been protected against influenza virus. And it's really because the beta-hydroxybutyrate is very good at inhibiting the NLRP3 inflammasome. So it's good at kind of dampening this pro-inflammatory state. And when it comes to something like short-chain fatty acids, in a ketogenic metabolism, the question is, do you really need all that fiber? Because beta-hydroxybutyrate, right? He had mentioned butyrate. You can actually make far higher serum levels of butyrate on a ketogenic diet. So it's very interesting. It's two totally different mechanisms, but with the same end goal and the same end point.
Some recent research I've been following that may be one of the underlying root causes of this uncontrolled inflammatory response with COVID-19. So I don't know if you want to speak any more the inflammasomes, because they kind of control, are you in inflammation or not? And that may be one of the important root causes, an uncontrolled inflammasome response to this virus.
Yeah, it's interesting when we look at ketogenic therapies, which were originally created for children with epilepsy, and it's likely the anti-inflammatory response on the child's brain that decreases the amount of seizures that these children have. And also, because the mitochondria are directly involved in our metabolic health, a lot of these conditions, our mitochondria have lost the ability to utilize glucose efficiently or effectively. So the reason that ketogenic therapies work is because they bypass the need for using glucose as an energy source, and they provide a brain-sparing fuel like beta-hydroxybutyrate. So what Dr. Penn has mentioned is with COVID-19 and SARS-CoV-2, it appears that one of the biggest pro-inflammatory pathways involves these proteins called inflammasomes. And the NLRP3 inflammasome, we know that ketone bodies are directly inhibitory. And so inflammation seems to be the buzzword, but like Dr. Penn said, sending these text messages, is it all tying back to anti-inflammation and this balance between dysbiosis and a good microbiome? You know, we can take all of these things and just tie them all back to the same central source.
It's like a scale, eubiosis, dysbiosis.
Yeah, super, super interesting. Well, is there anything else that we should touch on as far as SARS-CoV-2 or COVID-19, I think that, like I said at the beginning, the bigger pandemic that we really have is that 88% of people cannot meet these 5 parameters of metabolic health. And if we really attacked that as the root cause for most of chronic disease, now including COVID-19 and SARS-CoV-2, I think we could have a bigger impact on health worldwide.
Yes, I agree, Dr. Seeman. I think the core messages here is that we have an unprecedented, unpredictable pandemic with us right now, and there's fears, but I like to liken it to 3 concentric circles. One is you've got worry and concern, but then you have influence, and then you have control. Mm-hmm. And the more you work on things you can influence or control, you diminish the worry. It's been said, don't worry, be happy. Those people don't live as long, by the way. So you need some worry and concern, but work on what can you influence. And, from an infectious disease perspective, follow the CDC local health guidelines, of course, the non-pharmaceutical interventions, make sure you're doing good hand hygiene, and I don't like the word social distancing. It should be physical distancing. We need social connection right now. Mm-hmm. But smart physical distancing, we know that by and large this is spread within 6 feet, although it's plausible there's aerosol spread too. So wearing that mask, unless you've had known COVID-19, it's my personal opinion, we should, as we open up our society, we may well want to be wearing a mask, because what that does, it prevents me from giving you COVID-19 if I have asymptomatic or pre-symptomatic shedding. And we now know up to 50 to 70, 80% of people, if you do that test, that nasopharyngeal swab, which they tell me is horrible, by the way.
Yeah, it's pretty deep.
The 50 to 70, 80% of people may have asymptomatic virus, and the highest level of shedding is around the time you're becoming symptomatic. So that mask may prevent us from spreading it to others. And looking at the environment, the disinfection, not touching your face unless you've done good hand hygiene. But I think as we're leading to, I think you've got to start asking, well, what makes me vulnerable to complications? And that's where you begin to look at immune support. You need to ask yourself, do I have risk factors? Am I in that 88% where I don't have optimal metabolic health? And if I do have those risk factors, see your healthcare provider to ask, well, what's my fasting blood sugar, my triglycerides, my HDL level, checking blood pressures, getting a waist circumference. All very important. Those are the 5 metrics. And even one of those throws you into a suboptimal metabolic health. Now, there's a cluster called metabolic syndrome where you have 3 or more of those, but any one of those appears to weaken your immune system. So I think you need to work on immune support, and that is lifestyle modification. It starts with diet, I think, as we've discussed.
I think that's
nutrition.
The number one thing that people can control. People have, you've seen it swirling around on the internet, the amount of, supplement with vitamin C and vitamin D and zinc and A and all of these things that are important for, quote unquote, supporting the immune system. But do you think even with underlying metabolic disease and dysbiosis that supplementation is helpful, or to what degree could that be helpful? Or is it really fixing these root causes that's going to be the most effective at getting rid of this?
I really think you've got to focus on those risk factors, focus on correcting those first, because I'm afraid that you may be able to take all the vitamin D, C, zinc, and so on, but I'm not sure how much you can override that chronic inflammation, because I think you've got that bed of smoldering embers, so to speak, and then you throw COVID-19, which is just fuel on the fire, and you go from phase 1, which is that incubation, to phase 2, where you're getting symptomatics and get pneumonia, and then by the time you get to phase 3, that's that so-called cytokine storm, where that inflammation is really taking off with that the embers, so to speak, of the chronic inflammation from the chronic medical conditions.
Yeah, I'm in complete agreement. We have a huge problem, not only here in the United States, but really worldwide.
It's a pandemic, as I think
It
you've
is.
referred to. That is the greater pandemic that we need a wake-up call, I think.
Yeah, and it's unfortunate not a lot of people want to talk about it because there's some politics surrounding it, and what nutritional recommendations we have, and the politics with food supply, and it's definitely a complex issue.
I think the scale is public health economics. Public health economics. If you're really rational, and objective, I think focusing on that public health is important. You've got to get a balance. I'll be the first to admit, but without focusing on that vulnerable population as we open up, I'm afraid, we've been lucky so far in Nebraska to keep the curve flattened, as they say, but if we open up and all of a sudden we have the surge here and there, especially in higher risk communities, nursing homes or meatpacking plants and so on, unfortunately, I think we're going to see a toll taken on those that do not have optimal metabolic health.
Yeah, and unfortunately, where people's health lies today is the culmination of decisions that they've made for years and years. So this isn't something that's going to go away overnight, that's for sure. Yeah. Well, thank you so much for being here today and giving us your insight and your expertise. I look forward to many more of these in the future for all of you to enjoy.
Okay, well, thank you, Dr. Seeman. It's been my pleasure.
Thanks for joining us here today. We hope you really enjoyed this conversation about the bigger pandemic than COVID-19. If you want to comment or give questions below, we'd be happy to address those for you. Please like this video, share it with anybody that you feel that this would help. And of course, you can click the subscribe button and turn on notifications so that you can see our future content.